My name is Anne Römer-Mahler. I am a lecturer in international relations here at Sussex and a fellow at the Center for Global Health Policy. Together with my colleagues Stefan Elber and Chris Long, I work on a research project with the title Pharmaceuticals and Security, which has received funding from the European Research Council. As Stefan explains in much more detail in his video clip, the project essentially explores collaborations between pharmaceutical companies on the one hand and governments and global health initiatives on the other. Such collaborations have been set up to develop and produce medicines and vaccines for which market demand is very limited, but medical need is great and often also political demand is significant. We are talking here about, for instance, medical countermeasures for threats from bioterrorism, future pandemics, but also certain infectious diseases, especially when they affect mainly poor people. And increasingly, we are also talking about antibiotics. The part of the research project that I am leading looks specifically at collaborations that involve pharmaceutical companies from low and middle income countries. The pharmaceutical sector in low and middle income countries has grown significantly in the last couple of decades. And also from the perspective of global health governance, pharmaceutical companies from low and middle income countries play an important role. They play an important role firstly because they provide a large proportion of the medicines and vaccines that global health initiatives such as Gavi Alliance and the Global Fund procure. And in addition, and more recently, pharmaceutical companies from low and middle income countries also play an important role as partners in the process of research and development for new drugs. This is a rather recent phenomenon. We're talking here probably about the last 5 to 10 years. And it reflects very much the increasing capacity of companies generally in emerging markets such as Brazil, China, and India to innovate and do technologically more advanced work. From the perspective of our research project, this raises the question of whether collaboration with pharmaceutical companies from low and middle income countries creates a specific set of opportunities and also challenges for global health initiatives and for governments. On the basis of preliminary research, I have come up with a number of hypotheses about what those opportunities and challenges may be. From the perspective of pharmaceutical companies based in low and middle income countries, I assume that collaboration with global health initiatives could be particularly interesting because it opens up and facilitates access to resources that are difficult to access in the domestic context. For instance, finance, new technology, but also the opportunity to open up international markets. But also from the perspective of global health initiatives, I assume that collaboration with pharmaceutical companies from low and middle income countries could be particularly interesting because these companies could conduct, potentially, research and development at lower cost than pharmaceutical companies based in high-income countries. But as I said, I also assume that there will be a number of challenges involved in collaboration with pharmaceutical companies from low and middle-income countries. One such challenge may be that the still limited technological capabilities of those companies and also their limited experience with international collaboration may mean that global health initiatives have to take on a more active role in the process of drug development. As I said, so far, these are hypotheses, and I am currently in the process of exploring them through interviews with industry, government, and global health initiatives. And as soon as we have findings from this empirical research, we will put them on this website. For the time being, I thank you very much for your interest.